Shoulder flexion. The patient position is supine. Hand placement and procedure. The upper hand grasps the posterior aspect of the distal humerus, just above the elbow. The lower hand stabilizes the lateral aspect of the thorax, and when doing flexion, put the lower hand on the superior aspect of the pelvis to stretch latissimus dorsi. Move the patient's arm in a full shoulder flexion to elongate the shoulder extensors. Shoulder hyperextension. Patient position is prone. Hand placement and procedure. The upper hand supports the forearm and grasps the distal humerus. The lower hand stabilizes the posterior aspect of the scapula to prevent movements. Move the patient's arm into full hyperextension of the shoulder. Shoulder abduction. Patient position is supine with 90-degree elbow flex. Hand placement and procedure. With elbow flex 90-degree, upper hand grasps the distal humerus. The lower hand stabilize or support the lateral thorax. Move the patient into full shoulder abduction.
Patient position supine, hand placement and procedure. Put towel under arm, abduct the shoulder to comfortable position at least 30 to 45. Upper hand grasp the mid forearm and lower hand stabilize scapula and support deltoid, then external rotate the patient's shoulder. Patient position supine, hand placement and procedure. Put towel under the arm and abduct the shoulder with elbow flex to 90. Lower hand stabilize anterior aspect of the shoulder and support the elbow and forearm and hand. Grasp the palmar surface of the hand with upper hand and move the patient arm into internal rotation.
Shoulder horizontal abduction. The patient position is supine, near at the edge of the table with 60 to 90-degree elbow flex. Hand placement and procedure. The lower hand grasps the anterior aspect of the distal humerus and the upper hand stabilizes the anterior aspect of the shoulder on the deltoid. Move the patient's arm below the edge of the table into full horizontal abduction. Note that the horizontal adductors are usually tied bilaterally. Stretching techniques can be applied bilaterally by the therapist, or bilateral self-stretch can be done by the patient by using a corner or wand. Elbow flexion. The patient position is supine or sitting. To increase elbow flexion, stretch the one joint elbow extensors. Hand placement and procedure. Upper hand grasps the distal forearm near at the wrist. Patient side arm support on table. Upper hand stabilize the proximal humerus. Using lower hand, flex the patient's elbow just past the point of tissue resistance to lengthen the elbow extensors. To increase elbow flexion with the shoulder flex, stretch the long head of the triceps. The patient position is sitting. Hand placement and procedure. The lower hand stabilize scapula, and using upper hand, flex the patient's shoulder as far as possible, while maintaining shoulder flexion. Grasp the distal forearm and flex the elbow as far as possible.
Patient position supine, towel under arm with abduct 30 to 40, forearm pronated. Lower hand grabs the distal forearm, upper hand stabilize the scapula and proximal humerus, then extend the elbow just part of the point of tissue resistant to lengthen the elbow flexor. Patient position supine, close to the side of the bed. Hand placement and procedure. Upper hand stabilize the anterior aspect of the shoulder. Lower hand pronate the forearm, extend the elbow, and then extend the shoulder. Patient position, seating, hand placement, and procedure. Patient humerus supported on the table with elbow flexed to 90, lower hand grasps the distal forearm and upper hand stabilize humerus, and supinate or pronate forearm just beyond the point of tissue resistance. Make sure na hindi natin iti-twist yung kamay niya to prevent stress, and dapat sa may wrist. And next, extend yung elbow. Patient position, seating, towel forearm, and hand placement and procedure. Supinate the forearm and place it in mid position. Upper hand grasp the dorsal aspect of the hand. Lower hand stabilize the forearm against the table and flex the wrist using upper hand. In extension, pronate the forearm and place it in the mid position. Upper hand grasp the patient palmar aspect of the hand. Lower hand stabilize the forearms against the table and extend the patient wrist using upper hand.
Radial deviation. The patient position is sitting. There is a towel under the forearm of the patient. Hand placement and procedure. The upper hand grasps the ulnar aspect of the hand along the fifth metacarpal. Hold the wrist in mid position. The lower hand stabilize the forearm. Then using upper hand, radially deviate the wrist to lengthen the ulnar. MCP joints of the digits. The patient position is sitting. There is a towel under the forearm of the patient. Hand placement and procedure. The lower hand stabilizes the metacarpal with the thumb and index finger. The upper hand grasps the proximal phalanx with thumb and index finger. Keep the wrist in mid position. Using upper hand, move the MCP joint in the desired direction for stretch. Allow the interphalangeal joints to flex or extend passively.
Patient position, seating, towel under forearm. Upper hand grasps the middle or distal phalanx with thumb and finger. Lower hand stabilize the proximal or middle phalanx with the thumb and finger. Using upper hand, move the proximal interphalangeal joint or the distal interphalangeal joint in desired direction of stretch. Patient position, supine, hand placement and procedure. Upper hand flex the hip and knee. Lower hand stabilize the opposite femur to prevent posterior tilt of the pelvis. Using upper hand, move the patient hip and knee into full flexion. Patient position, supine, hand placement and procedure. With the patient fully extend knee and upper hand support the patient lower leg with your arm and shoulder. Lower hand stabilize the opposite extremity along the anterior aspect of the thigh with your hand. With the knee at 0-degree extension and the hip in neutral rotation. Flex the hip far as possible. Patient position, half lying, hand placement and procedure. Upper hand hold the hip and knee are flexed toward the patient chest to stabilize. Lower hand, nakahawak siya medyo taas ng knee anterior aspect of the thigh. Then using lower hand, move the hip into extension or hyperextension by placing downward pressure.
Hip extension with knee flexion. Patient position. Patient is in prone lying position close to the edge of the table. Hand placement and procedure. With the hip held in full extension on the side to be stretched, move your hand to the distal tibia and gently flex the knee or the extremity as far as possible. Don't allow hip to abduct or rotate. Hip abduction. Patient position is supine. Hand placement and procedure. The lower hand support the distal thigh with arm and forearm. Upper hand stabilize the pelvis by placing pressure at the part of tibia, maintaining the opposite lower extremity in slight abduction. Abduct the hip as far as possible.
Position side lying, hand placement and procedure. Upper hand stabilize the pelvis, lower hand will flex and knee extend the patient hip to neutral or into light hyperextension. Let the patient hip abduct with him or herself and apply additional stretch force with lower hand to the lateral aspect of femur. Patient position prone with hip extend and knee flex to 90. Lower hand grasp the distal tibia, upper hand stabilize the pelvis sa may iliac crest. Then, using lower hand, apply pressure to the lateral malleolus and externally rotate the hip as far as possible.
Hip internal rotation. The patient position is prone position with hips extended and knee flexed to 90 degree. Hand placement and procedure. Lower hand grasp the distal tibia. The upper hand stabilize the pelvis by applying pressure on the iliac crest across the buttocks. Using lower hand, apply pressure to the medial malleolus or medial aspect of the tibia and internally rotate the hip as far as possible. Knee flexion. Patient position is prone position. Hand placement and procedure. The lower hand stabilizes the pelvis by applying downward pressure across the buttocks. Upper hand grasps the anterior aspect of the distal tibia and flex the patient's knee. In the alternate position and procedure, have the patient sit with the thigh supported on the treatment table and leg flexed over the edge as far as possible. Stabilize the anterior aspect of the proximal femur with one hand. Apply the stretch force to the anterior aspect of the distal tibia and flex the patient's knee as far as possible.
Patient position prone with towel under the thigh, hand placement and procedure. Grasp the distal tibia with upper hand and stabilize the buttock using lower hand to prevent hip flexion, then slowly extend the knee using lower hand to stretch the knee flexor. Patient position supine, towel under thigh. Upper hand grasp the knee and lower hand grasp the distal lower leg, then extend the patient knee. Patient position supine, hand placement and procedure. Upper hand stabilize the anterior aspect of tibia and lower hand grasp patient heel, then using lower hand dorsiflex the talocrural joint of the ankle by pulling the heel and apply gentle pressure pataas sa head ng metatarsal with your forearm.
Ankle plantar flexion. The patient position is supine. Hand placement and procedure. The upper hand supports the posterior aspect of the distal tibia, and the lower hand grasps the foot on the tarsal and metatarsal areas. Using lower hand, apply the stretch force to the anterior aspect of the foot and plantar flex the foot as far as possible. Ankle inversion and eversion. The patient position is supine. Hand placement and procedure. The upper hand stabilizes the talus by grasping just distal to the malleoli. Grasp the calcaneus with lower hand and move it medially and laterally at the subtalar joint. Stretching specific muscles of the ankle and foot. The patient position is supine. Hand placement and procedure. To stretch the tibialis anterior, which inverts and dorsiflexes the ankle. Grasp the dorsal aspect of the foot, across the tarsal and metatarsal, and plantar flex and abduct the foot. To stretch the tibialis posterior, which plantar flex and inverts the foot, grasp the plantar surface of the foot around the tarsals and metatarsals, and dorsiflex and abduct the foot. To stretch the peroneals which avert the foot, grasp the lateral aspect of the foot at the tarsals and metatarsals and invert the foot.
Patient position supine. Hand placement and procedure. Upper hand stabilize the bone proximal to the restricted, then lower hand move the phalanx in the desired direction.